Good morning, gentlemen. This is Dr. Mohammad Asif, and today I will be speaking about the safeguarding mental health in AI-driven work environment. Particular topic is about the smart occupational health solution for SMEs, which is AI-enabled workplace safety risk assessment and the well-being. This is a work model for Saskatchewan province and similar some other remote working population, who will go in more detail about in the coming slides. Now, the first thing is about some challenges for such businesses. What does that mean is that many small and medium enterprises face a very important and challenge because they are expected to maintain workplace safety, comply with the occupational health regulations, and protect workers' well-being, often with very limited occupational health resources. Compared to the large organizations, usually they have like more dedicated occupational health departments, industrial hygienists, safety professionals, and compliance system, etc. But SME generally they lack these systems. You can see here, like I found over the net, like one of the requirement from HSE in Saskatchewan, and that is about the occupational health and safety for the first aid and on the workplace. Now, this thing is, we are not sure about in remote location how many percentage of SMEs have access to get the prompt right support to make compliance for that. And also the government or probably the regulatory departments, they may not have a very good understanding of each business who is in their territory, how much they are compliance for those requirements as well. Now, why this matters to us all? Because I understand AI innovation is now is like a thriving and global voice. Every country they are running behind the AI based systems, and that is why the new companies and new solutions are developing every day around it. I will give an example, and based on that, I have give an example for that. So consider it like if there is a work supervisor, a worker, or SME owner who can use a mobile application directly from their workplace, and they may not have access to the specialist for the subject matter. So what they can do, they can capture the photograph of chemical, equipment, condition, environmental concerns, or unsafe practices, and they can send it to the centralized system. From there, all the work will be done on the background from AI system. And the system will generate a report. It will send back to the person and they can look at it. This sort of platform, it is very workable and accessible. They are mobile based, and in this model the analysis and information and a structured occupational risk assessment report is generated that can be sent back to the SMU employer or worker on that. Now, all this thing, when it is done correctly, it has like its own psychological well-being impact. And as you know, when there is a regularity requirement, it puts stresses on the people. And when it is well complied, it takes those stresses out from them. So I see this AI-enabled remote working system is a psychological betterment for the people as well. And when the safety culture improves and the workforce confidence improves as well, well-being improves on the contrary part. Because HSC compliance generally are complex, implementation is long and time consuming, and they are costlier business as well. A very well guided AI approach will offset these stresses free. HSC compliance that make owners and workers stress free, and the government capture the fatigue and worker concern as well through the surveys, which can capture from the same AI based program from their mobile, from their workplaces as well. In cases of trouble cases, they can go back and investigate and provide the required support services to the people as well. So both entities will have like their own confidence about it. This program or this has its own strategic value. Of course, AI is not intended for people to be replaced. It is not intended to be clinical judgment. It is not intended for industrial hygiene replacement, but this is a two-way occupational health intelligence, support the rural remote SME workforce and conditions, and it is aligned with the Saskatchewan in innovation and overall AI strategy as well. So in conclusion, I can see that this AI model is like a strengthening tool. It should empower small businesses and the workers. And the digital occupational health can spare specialist reach only for the selective cases, so resource proper utilization. And this system is a futurist. It's a future of this system must be the preventive, connected, and accessible. Now, the safety. In conclusion, we can say safer workplaces, safe, smarter compliance, and the healthier communities is over and all objective of all this our presentation. Thank you very much for listening, and I appreciate your time.